Good morning, Walter.
Morning, Randy. It's always a pleasure to see you, old friend.
Great to have you and be with you. Stay tuned. I think Walter's got some lovely insights that you're going to want to listen to.
Maybe.
I believe during this whole COVID fiasco now, it's turning more into a fiasco. What we haven't heard from are people on the ground who are working. We've heard from the experts, but I think it's important that we learn and hear from people who are working and getting through this COVID period of time. Walter's a electrical contractor, does a lot of work throughout Eastern Ontario.
Correct.
And general contractor.
And general contracting.
Has about 50 to 100 people on his in his employ. So Walter, let me just start off with this question.
Yes.
You've been working, your men and your women have been working all through COVID.
We sure have.
Since pandemic was announced in March, you were deemed essential.
Correct.
Unlike the white-collar professionals who were told to stay home and collect their money,
Yes.
you guys have been working, and on many different job sites. The question I have for you, has any of your employees ever contracted COVID during this pandemic?
Yeah, to make a long story relatively short, the simple answer is no.
No.
There has not been anybody within our employ that has contracted COVID, specifically when it comes to working on a construction job site. I actually reached out to John DeVries yesterday, the president of the Ottawa Construction Association, just to ask him how many cases of COVID have been contracted on construction sites in Ottawa. So he informed me that we have a workforce, he's put it in the ballpark of 40,000 men and women working in the construction industry, and 0 have contracted COVID from a construction job site.
So 40,000 people on the job site,
Correct.
various job sites,
Yes.
different electricians, plumbers, sheet metal workers.
Every trade. Painters, right?
Coming and going.
Yes. And working in close proximity, don't forget,
Right,
in many cases too, right?
And not one has received contracted COVID.
0.
0. And that's the same with your business.
Correct. So I've also reached out to George Gritsiotis, who's the CEO of the Ontario College of Trades.
Yeah.
And I sit on the Board of Governors for the Ontario College of Trades to find out, and I haven't got the data back yet, but from general conversations we've had, I believe there have been a couple, but it's very, very slim given the huge, we're talking about hundreds of thousands of people that work in construction in the province of Ontario.
Right. But even in Eastern Ontario, in the Ottawa area, with 40,000 people, because Ottawa was deemed to be a hotspot for COVID as well. So hotspot, 40,000 people working, close proximity, essential workers, 0 cases.
A big fat 0.
It's
which is really mind-boggling. I've been listening to the teachers union, not the teachers themselves. I have a lot of respect for our educators, and I just can't believe the fuss that the unions are putting up about trying to get back to work or not getting back to work, right? And the demands that they're making. They've politicized this entire process, as far as I'm concerned. And you also got to remember, in our work world, we employ a lot of young, healthy men and women, right? And not to mention, people of your age and of my age also on top of that, right? But they're all hardworking, healthy, working in many cases an outdoor environment, in many cases a closed environment, and there have been 0 cases.
Right on. Listen, one question: were masks mandatory? Did you make your employees, or were they required back in March and April during the height of the pandemic? For tradesmen working on the job sites?
In close proximity, they were required to wear some masks, but nobody's wearing masks right now on the job sites. We had hand sanitizers. We had to follow the protocols that were put in place to keep people safe. Nobody knew the extent of this pandemic. Nobody knew much about COVID at that time. It could have been very serious the way that it was being made out to be. But I believe the exact opposite has actually happened, right?
Right.
And even I think I mentioned to you, my mother is 78 years old. Frightened to hell about what's happening in the media, on the news. I've even stopped listening to the news. It's COVID overload as far as I'm concerned. I haven't hugged her. I haven't kissed her since March. This is a woman that is petrified right now, thanks to all the mass hysteria that's been out there.
I think that the damage that we've done to the elderly and the fear that we've instilled in people
Sure.
has been far more detrimental and is far more likely to lead them to an early grave than COVID.
Oh, I have no doubt about that. And the other consequences, my mother has horrific arthritis in one of her hips.
Yeah.
And she's been on a wait list now for a hip transplant for quite some time.
Yeah.
And that's just been delayed and delayed and delayed. And, she's having to live in excruciating pain because of the back. And I can't imagine what the backlog is going to be like when things get somewhat back to normal.
Well, we know right now the latest data out this week was it's now 250,000 medical procedures, necessary medical procedures have been postponed or canceled or delayed.
Can you imagine the pain that's caused people?
And near 2 years just to deal with that backlog. So somebody who had been waiting for cataracts or a hip replacement, and they may have been waiting for 6 months or a year prior to COVID, now can look forward to another 2-year wait. Or up to 2 years.
And there's no quality of life when you're in that kind of pain.
No.
24/7. It doesn't stop when you're going to bed.
Yeah. So listen, one of the other things that I want to ask you about, because I've had these questions posed to me from my constituents, are apprentices who are not being able to get scheduled into schooling to complete their schooling, and really important as well is apprentices who have completed their hours of the apprenticeship, completed their schooling, but they can't write exams. Now, I understand that the Ontario government is now going to start allowing people to write their exams.
Yeah, I believe it started, and I posed this to our CEO, George Gritsiotis, also. And it seems that when the pandemic hit, everything got shut down, right? So exams that were scheduled were canceled. So we've had a backlog, and they have started doing exams again.
Right.
So I don't know if they're doing the same quantity that they were, whether the classroom sizes have been shrunk a little bit to accommodate social distancing and other protocols have been put in place. But we're starting to get back, because I have a few of my apprentices who are completed apprentices right now.
Well, I know when I was an apprentice,
yes,
and I completed my
That's when
hours,
you used to work.
When I used to work.
That's when we used to work together like 35 years ago.
That's right. But once you completed your schooling, once you completed your hours, everything is fresh in your mind.
Of course it is.
And you want to get in there and write that exam and get your journeyman's ticket.
Correct.
And also get a substantial bump in your wages.
Correct.
So that's all been really stymied and stalled for the last 6 months.
It has for our apprentices when they complete their apprenticeship.
Yeah.
Given the circumstances, we will bring them up to a journeyman's wage, which is about a 20% increase in pay from fifth year to a journeyman electrician, correct?
Right.
Because it's not unfair. It's unfair for them, is what it is.
Absolutely.
Right.
Well, that's good to see that is starting to be
coming back.
But we see that in every aspect of government delivery of services, been a shutdown of services, huge backlogs, and very little, well, I would say no added resources to alleviate the backlog quickly.
I haven't noticed a difference. Have you?
Yes.
That's the irony of this, right? I think if we put them on the CERB, maybe there'd be a different story, right?
Well,
maybe you'd see them want to come back to work a little bit faster.
Right.
And maybe put the teachers on CERB.
Well, maybe I should ask you that question. We have all these various subsidies and all these different programs that have been announced by our federal and provincial governments, and one of them is the program where the federal government pays 75% of your employees' wages.
The wage subsidy? Yes.
Yeah. Are you qualified for that?
We are qualified.
So the federal taxpayer is paying 75% of the wages of some
up to $800 or whatever that value is, right? And as you know, the journeymen, they're making a lot more money than that.
Yeah. Right. Then there was also the rent subsidy. I don't know if that impacted your business.
No, not at all.
No,
not at all.
Okay. And what about the CERB? Now I know most electrical apprentices, most journeyman apprentices, in the work that you do, it's a high earning career.
Sure is. They'll make $100,000 as licensed electricians, actually.
Right on. So has the CERB had much of an impact? Either in your business directly or in other supply chains that...
in our business directly, there hasn't been any impact. As far as supply chain, I have heard from others that are downstream who are not paying the same wages. That they're having a hard time trying to find people. And the other friends of mine that have restaurants that they own or bars, they're having a horrific time trying to find people. Right. I mean, why would they work when they're getting paid $2,000 a month just to stay at home right now? Right. That's their attitude, which is a sorry attitude. And I commend some of my friends out there who have said to their kids, "You are not going on CERB. If you want to get money, you get out there and you work." And I think that's the attitude that we should be taking.
Yeah. Well, listen, there's clearly, there was a lot of people, last count that I saw, in Ontario alone, we had 3.5 million people on the CERB, plus about another million people on unemployment insurance. That's and a lot of people, especially back in March and April and throughout that whole period of time, their jobs just vanished.
And that's fair. Those people deserve some sort of compensation, right?
But then there was others who, for whatever various reasons, it was a fairly, and we know this to be true, it's not everybody, but it was a fair incentive not to go to work as well.
It still is.
Yeah.
I was just down Carp Road the other day, and there was a couple of signs for a couple of businesses that were looking for people.
Right.
I haven't seen that for a long time, where they're actually putting signage on the side of the road. And you know what? They can't find people. That's the irony.
So here we have about 4.5 million people unemployed.
Yes.
And we can't find people to work.
No, 100%.
Yeah.
It's ridiculous, isn't it?
Oh, listen, I think this whole, our whole response to COVID has been irrational. That's my personal view.
Are you going to be wearing a mask now when you have sex? Did you see that the other day?
I did. Like this is, the absurdity of COVID just knows no bounds.
I know.
Yesterday, the Chief Medical Officer of Health for Canada came out and said, having sexual relations may cause the spread of COVID. And if you're engaged in those sort of risky behaviors of having intimate relations, you should wear a mask over your nose and mouth and not kiss. And then she went one step further and said, it would be safer to engage in solo sex.
With a mask or without a mask? I'm not sure. Did she clarify that?
That's a question I'll have to pose to the federal government. Is solo sex with a mask? Or
this has been ridiculous, hasn't it? Like leadership starts from the top down, right? And you say what you do and you do what you say.
Yeah.
And as far as I'm concerned, Theresa Tam has been horrific throughout this entire freaking process. Right?
Well, listen, it's just been one contradiction after another.
That's all it's been. How can people take anything seriously?
The virus has no borders. Yes. We're going to allow passenger planes arriving from Wuhan and from all around the world to come in.
And they're still coming in.
And they never stopped.
Yeah.
But our land border is closed. And at the same time we were allowing passenger planes to land in Canada, we were saying it was too dangerous to have cruise ships come into any port.
I know. It doesn't make any sense, does it?
And that stigma was a more dangerous, a more dangerous element to ensure we didn't engage in than the virus. And of course, March and April, masks were not mandatory. They were not going to do anything to prevent the spread of the virus. And then by July, it's mandatory. After the pandemic has clearly ended, the number of cases are near zero. The hospitalizations and fatalities are near zero. And now it's mandatory to wear the mask when the virus is no longer present.
So much of this, Randy, is so contradictory and just doesn't make any sense. And if it doesn't make sense to us, how can you trust the judgment of these professionals that we have that are in charge of these organizations? I just look at what we had, 8,900 deaths in Ontario, I believe.
No, in Ontario we're at 2,900 deaths, about 1,000 outside of long-term care. The rest have been in long-term.
Out of a predicted 100,000 when this all started.
That was the number that was used as the projection that we had to deal with, that we wanted to make sure that all these restrictions of wearing masks when you're having sex, for example, it didn't lead us to 100,000 deaths. So the lockdowns on our economy, the shuttering of our hospitals, the underutilization of healthcare, the closure of our education systems, that was all to prevent this catastrophic apocalyptic number of 100,000 deaths. And instead, we see about 1,000 deaths outside of long-term care.
Yeah.
All, the average age is in about 80 years of age
Yes.
in the province. Just about everyone had multiple chronic illnesses or comorbidities. And, the evidence is pretty clear that if you're healthy, the virus is not going to impact your life to any significant degree.
Correct.
You might get sick.
Yeah. Like an influenza.
Well, like a cold and influenza, people get sick.
Wish they didn't, but that's just a natural reality of life.
So, but yeah, being sick is scary today.
Yes.
It is scary, and it justifies the closure of our democracy, the closure of our economy, the end of personal freedoms and responsibility to make decisions for the betterment of your life and your community, and because you may get sick.
Yeah, and you touched on long-term care facilities, right? And it seems it was horrific what happened, right? You lock them down, you leave them in an incubator,
Yeah.
full of PSWs that are going from facility to facility, spreading the disease, and locking them in their rooms, and
terrifying them.
for sure.
Terrifying elderly people, preventing them to get comfort from their loved ones, cutting them off from any of their family support, and really.
Can you imagine if your mother was dying in the hospital and someone's telling you you cannot go in and comfort her and to see her at her last moments? Unimaginable that happened.
Well, I know when my mother was in hospital years ago.
Yes.
And that was one of the most important elements for my mom and for all my brothers and sisters. We were in that room with her and giving her comfort, and it was. I can't imagine. I think it would have been cruel to prevent families from providing that comfort and that love.
Extremely cruel.
Yeah.
Extremely cruel for the one that's dying and for the loved ones that want to go spend those last moments with them. But yet we allowed protests to happen everywhere.
Yes.
Right? With no ramifications whatsoever.
Yes.
I mean, it's the hypocrisy, and I think that's the worst part of this entire process right now that's gotten to me. I mentioned to you, I love listening to CFRA. I love news radio. I turn it on. I haven't listened to it for weeks now.
Yeah.
Because I am just in COVID overdose. I mean, I'm an overload right now, right? Yeah. It's too much, and what they're saying, I'm not seeing. And maybe I think that is the problem. If I was seeing it around me and hearing of all sorts of friends and workers and other people catching COVID and getting seriously ill, I'm not to say that people aren't and haven't gotten seriously ill, but they have in subsequent years and past years with flus and other ailments that have come around.
Well, I think that's the really the key point here is we're being told by the experts not to believe what we see and what we hear and what we experience. Like what we see, hear, and experience is unreal. There is a greater reality that none of us can see, and it's this fear of COVID, this COVID and its associated fear. And since when in human history has anybody been told, don't believe what you know to be true and believe something that you can't actually see?
Yeah, very true. Yeah. Very, very true. I don't recall a time in my lifetime, Randy. So it's unfortunate.
Yeah. Walter,
pleasure.
It's always a pleasure.
Man. Thank you very much. Keep up the great work, Randy.
And listen, I should have given a warning to the people watching this video.
Why is that?
Well, here we are without masks.
Oh.
And
I don't have COVID, do you?
I don't have COVID either. But listen, it's a pleasure.
Yes.
You weren't coerced to not wearing a mask, I don't think.
No, I was not. No, I wasn't. And just to let you know, I did offer Randy a stool to stand on so that he'd be my height or a little bit taller.
That's right.
But always a pleasure, man. We go back a long way, and I love it.
Thank you very much.
Great work, Randy.
Bye-bye. If you agree with me that government policies and restrictions regarding COVID are unreasonable and disproportionate, let's get the message out. Share this video, like it, tag some friends, and together, let's tell government that we want a return to freedom and democracy.